Hi, good evening, everyone. Welcome to Field Trip House Open House. We'd like to welcome those who have joining us tonight. My name is Conrad Page. I work for the growth team at Field Trip Health. And I'd like to welcome you to tonight's open house. Tonight, we're joined by one of our fantastic therapists, Jordan Dobrowski. She's one of our amazing practitioners out of the Chicago clinic. And I'd also like to welcome Katie, who is one of our clients at Field Trip Health. They're both here tonight to talk about what is like working with Field Trip Health, what can you expect as you go through our program, and to answer some of your kind of questions or comments or thoughts about what we offer. I'm also pleased to be joined by my colleague, Alex Sherman. He's helping manage our discussion tonight from a technical perspective. The intention for tonight is really to invite everybody here into the conversation. So we welcome you all. Before we get started, there's a few quick housekeeping notes I'd like to go over. You'll probably notice a chat bar to the right of the functionality here on screen, which we invite you to use to share your thoughts or comments throughout the session. Feel free to introduce yourself or where you're from or anything else that comes to mind throughout our chat tonight. If you have any questions to type out, please use the questions tab, which you can find near the bottom right corner of your screen. This way, our host can see and respond to your questions quickly. So we're so excited to open this space tonight for those who are interested in our line of work. And I'd love to turn it over to Jordan, who will start us off with a quick guided meditation to help ground ourselves and frame our intentions for tonight's session.
All right.
Take it away.
Well, hello, everybody. It's so good to be here. As Conrad mentioned, I'm going to get us started in a brief meditation. A few things that I want to just kind of lay out there, because I know not everybody is super familiar or comfortable with meditation. The first is that it's a really personal practice. And so there is no right or wrong way. I would say one of my goals in meditation is usually the number of times I come back to the focal point, which might be in this point, my voice. I'll give you some other things to focus on through it all, but it's not about staying focused the whole time because that's really hard. It can also be kind of challenging for people for other reasons. Difficult emotions can show up at times, difficult sensations. And so if that's the case, feel free to stretch your body, open your eyes if they were closed, just kind of shake it off a little bit. And then you can join us back when we come to kind of the storytelling. So at this point, what I'd like for you to do is to find a comfortable position. Usually I recommend to have your spine in alignment. That can be laying down, that can be sitting, that can be standing if you're into that. But just finding a way that you can start relaxing some of those muscles. If you're comfortable, you can close your eyes. If that's not comfortable, you can find a spot to kind of gaze and just kind of zone out for a bit. A spot on the wall or the floor often works well. We're going to start toning into our breath, noticing just our natural rhythm, not trying to change anything. Paying attention to the way that we can feel the air pass through our nose or our mouth, past our throat and into our lungs. I invite you to let that breath fill the entire abdomen, letting your stomach expand, letting your shoulders relax. Maybe just breathing in a little bit slower this time. Breathing in, 2, 3, 4, and out, 2, 3, 4. Breathing in, 2, 3, 4, and out, 2, 3, 4. Continue at a pace that feels comfortable to you. At this point, I'd like for you to choose a quality that maybe you're trying to work on. Perhaps it's confidence, perhaps it's self-love, Perhaps it's patience, whatever that might be for you. I want you just to tune into that for a moment. Notice where you might feel that in your body. I invite you now to imagine an orb of light in this part of the body. Imagine about the size of a golf ball to start. Perhaps it's a certain color to represent that quality you're trying to grow today. Perhaps there's a smell or another sensation assorted with it. Just imagining it there. And with each breath now, I want us to imagine we're blowing a balloon up. So that golf ball expands as we breathe in, 2, 3, 4. And we breathe out. Except it doesn't exhale all the way because the ball keeps growing as we breathe in the next time. We breathe out, but that light just keeps staying. Breathing in, let it grow, and feel it in our body. And as we breathe out, we're recognizing what it feels like to have this quality, just a little bit. Breathing in, we grow it even more. Breathing out, we enjoy its company. As we continue this imagery, I invite you to imagine what it would be like to step into this quality. What would your life look like? How would you wear that on your body? Would your shoulders be tight or loose? Where would your sternum be if you had this quality? Imagine looking at yourself with this quality growing all around you. And what would you notice about yourself? Give just a couple of moments of silence for you to play out this scene. Finally, the last thing I'll invite you along to do as we settle into our body, our natural rhythm, our flow, our current state of consciousness. So offer yourself some gratitude for trying something new today. Whether or not you felt a huge difference, you made an effort, and that really does matter. You showed those inner parts of yourself that you're trying, that you're going to be there for yourself. And whatever you did grow, that's just a bonus. Now slowly bringing some attention to our fingers and toes, maybe giving them a wiggle. Rolling the shoulders and stretching the neck if that feels good. Coming back into our body even more. And when you're ready, open your eyes. Thank you so much. I hope that was a pleasurable experience, or at least something interesting. At this point, I would love to introduce Katie Parr, our wonderful client who's volunteered to be here tonight. So Katie, take it away.
Hey everyone, my name is Katie, as Jordan said, and I've been a client at Field Trip. I started exploring Field Trip and the treatment options for ketamine-assisted psychotherapy near this time last year. I did my, it's my dog. I did my first series of sessions and ending in the like early middle October last year. So I've done 6 sessions of ketamine therapy and 1 group session. And I intend to book another module, which is 2 additional individual sessions for next month. So that's me.
Awesome. And Katie, I'm wondering if you can tell us a little bit about what brought you to Field Trip when you were doing some of that investigation a year ago.
Yeah, so the initial thing was I was watching this show. I was still working from home, and so I had the TV on in the background. I was watching this show called This Is Life with Lisa Ling. Highly recommend. It's on CNN, or it was on CNN, but they have the last season on HBO Max as well. My dog wants to play. Yeah, now's not the time, bud. Sorry, guys. So she has an episode about psychedelic therapy. And one of the 3 people on this episode was doing ketamine-assisted psychotherapy. And as I was watching the show, I was really overcome and overwhelmed with how much I identified with these people that were seeking these therapies, how much they reminded me of myself. Their stories reminded me of my story. And so in my regular therapy session that week, I asked my therapist about CAP, ketamine-assisted psychotherapy, and if she thought it was something that I'd be a good candidate for. And she said, yes. She's actually in training to be a provider or a clinician for CAP. And so she was aware that Field Trip had just opened up an office here in Houston. And so she suggested that I go to the website and fill out kind of like the short kind of info form that they have on there. And lo and behold, within a few days, I was contacted by a psychiatrist with Field Trip to schedule, or I was contacted by the office manager to schedule a psychiatric appointment. And then we did that. So like all of that to say, it was kind of written in the stars, it seemed, that this was going to be a place where I could find some healing.
It's so interesting you mentioned written in the stars, because I was just talking about this earlier before we signed on about how I feel like my own journey to get to this point as a ketamine-assisted therapist has been kind of a cycle of, I started actually studying ethnobotany a little bit in college, and then got roped into religion and anthropology, and that led to me becoming a therapist. And I feel like this is a real way that I get to integrate all of those different fields.
Yeah, so cool.
Yeah. What was it like when you first got to those appointments then? What was it like to come into Field Trip?
Yeah, so when I started, actually at the time, they weren't doing any office visits unless it was a ketamine session. And that's because of COVID. So, which was really reassuring for me, because I've been very conscientious throughout the pandemic. And so it was nice that, they're treating the facility like a medical facility, which is what it is. You wouldn't want people to be spreading COVID in a medical facility. So what I'll say is, like, close your eyes and imagine like a kind of woo-woo, hippy-dippy, psychedelic therapy space. And that's what it looks like. Comfy chairs, like lush rugs, there's like a greenery wall, and very, very comfortable space. Mm-hmm. Like water features with like a Buddha, like kind of like what you would imagine it would look like. But the more important thing is that it was so welcoming, including the staff, a super tranquil kind of place. But, like my therapist in particular, her name is Bobby. She's a lot like me, like super energetic, she is not like the hello and welcome, kind of person. She's a lot more energetic than that. So lots of different personalities, all of them loving and caring. And everyone really helped me to feel comfortable getting started.
Yeah, I don't think I realized that you're with Bobby. Bobby is such a joy and delight to work with. Yeah. I've come across her in a couple of different settings, so that's fun.
Yeah, she's the best.
Yeah. And you were talking about the nature part, or like the environment that our offices are. And that's one of the things I really love, is how it brings up, you can tell there was a lot of intention put into the rooms.
Yeah.
Our office in Chicago is very similar. We've got like a moss wall, and then this beautiful integration lounge in addition to our offices. for individual treatment. A lot of, light curtains, and it really reminds me of, the light and the nature elements really remind me of like getting in touch with one's own light or getting in touch with one's own nature.
Right. That's good. I never thought about that, but that's true.
Yeah. So you got into the office, and then, one of the things that we ask our clients to do that I think sets it apart from other types of therapies is, we have preparation sessions, we have the ketamine sessions, we ask people to set an intention for each of their sessions, and then we have the integration. Mm-hmm. And I'm wondering, what was that preparation as you started to get to know Bobby a little bit? Like, what were things that stood out to you?
Yeah, so for me, the session was, for me personally, the sessions were not daunting. I've been seeing a therapist. Well, I've been in therapy for the better part of 9 years. I saw one therapist for a good 1.5 to 2 years, and then kind of dropped off for about a year. And then I've been seeing my current therapist now for over 6 years, almost 6.5 years. And that's either weekly or biweekly, depending on how I'm doing. So jumping right into talking about my diagnoses and kind of like my family of origin and the stuff that I carry with me every day. Jumping into that in the preparation session with Bobby was really easy. And, it helps that Bobby in particular, and I'm sure all of you guys, but she's the only one that I know for sure, is very highly credentialed. And so she knows what she's doing. This is not, it's not your run of the mill every day, like licensed social worker who is a therapist. These people are really professional and know the medicine and kind of know the different therapy models that we use in CAP. And so like one of the things that really struck me was how familiar my story sounded to Bobby, which is obviously kind of a relief because, a lot of the time, depression and anxiety and PTSD, all of which I'm diagnosed with, are very lonely places. It's very hard to understand, especially when in a major depressive episode, or when my PTSD is triggered. It's very easy to lose track of the fact that I'm not alone in this. And so, having her identify with, what I had to share and really listening to me and taking things in, made me feel so comfortable and made me feel like, okay, like this is a safe person. I'm in a safe space. I can really kind of do some good work here. Because, therapy and including CAP is hard work. It's not fun and games. Sometimes it's fun, yeah. But if you want to get a result, which I did, you have to be ready to put in some serious work. And so Bobby really helped to prepare me for that in our prep sessions.
Yeah, absolutely. And, you mentioned kind of the credentialing, and actually that's how I know Bobby, as we were in a similar training program specifically for ketamine-assisted psychotherapy. And I think a lot of our practitioners are, because it is such a different kind of therapy. It's short term for one. It's usually like 3 to 6 weeks all in all. Of course, people can come back for boosters, and some people really benefit from that. But it's different. And you're also right in saying like it's work, ketamine I really think works as like a catalyst to make things a little bit easier. And so some of the work can be really fast, a lot faster than other types of therapy. But you get what you put out of it. One way I kind of describe it, and I'm curious if this kind of resonates with you, is imagine being in a corn maze. My Midwest is coming out, so imagine maybe a hedge maze or whatever makes sense to where you're at. But you keep going on the same track, and it just doesn't seem to get you to where you're trying to go. Ketamine works by like pushing down those walls temporarily, but then it's up to you to take those next steps to go to the next side or the next track.
Yeah, 100%. It was in my third session, and I'm kind of skipping ahead in the timeline here a little bit, but it really ties into what you're talking about. In my third session, that was the first session where like I really felt the psychedelic side of the medicine. And I am someone who, the way that I've kind of taught myself over the many years, I started feeling depressed when I was about 12, 13, around puberty. And then I didn't get into treatment until I was 24. So, in that time period, the way that I would cope with my symptoms, for whether it be depression, anxiety, or complex PTSD, would be control. In my third session, the medicine was kind of trying to guide me. It was trying to be my Sherpa on this journey of healing. And I was resisting that, that kind of gentle guidance. It wasn't pushy, it wasn't overwhelming, but I overwhelmed myself with, what am I supposed to be doing right now? And to describe it for those of you listening, so in the treatment rooms, you sit in a zero gravity chair if you so choose. That's really ergonomic and super comfortable. And then I chose to have a weighted blanket over me during my sessions. But the non-negotiable is eye shade and headphones. And the headphones play a curated music or curated playlist that's made by Field Trip. So you can't see and you can't really hear the outside world, but your therapist will be on a microphone to be able to speak to you over your headphones. So Bobby started to notice that I was a little antsy, and she came on the headphones and she was like, what's going on? Because even in that moment of like wanting to control, I didn't want to say that I was having trouble, because it's like, those feelings of like inadequacy or, embarrassment about like, I can't just let go, so I didn't say anything, but Bobby noticed I was a little uncomfortable. So she was like, what's going on? And I was like, I don't know what I'm supposed to be doing right now. And she was like, what do you mean what you're supposed to be doing? And I was like, I know that what I'm supposed to be doing is like letting the medicine do its thing, but like, how do I do that? And she kind of sensed the urgency that I was feeling in that moment. And helped me to kind of calm down, first of all. But then also to kind of reframe my thinking, to consider the fact that maybe doing nothing is doing something. And so, after that, I was kind of able to get back into the journey for that session. And of course, we talked about that at length in my integration session, which thank God was the next day, because I needed to integrate that. So exactly what you're talking about, where the medicine accelerates a lot of these things or amplifies a lot of these things that are already inside of us, and can accelerate that healing journey. And the pace of the work is much faster with the help of the medicine. I would say I probably did years worth of therapy in 6 ketamine sessions. And I don't say that lightly, because I've been going to my therapist every week for 2 years. And she's incredibly effective, and I do great work with her. But sometimes we get a little stuck, and that's what I'd been feeling before I did ketamine therapy. So totally agree with you.
Well, and since we're right here, I'm wondering if you can talk a little bit to the difference between integration and the types of therapy you were doing before. Like, what did those integration sessions look like?
So the integration sessions were really, Bobby would ask me, like, the most common question was like, what did you learn and how are you going to use that in your life? Or how are you going to express that in your life? Or what's basically the question is, what changes now? So it's not just talking through the experience that I had while on the medicine as like a talk therapy session, but it's more, we do that. And then we talk about how that's going to impact my everyday life going forward. What kinds of things am I going to change or work on, because you don't just change, it's not, you can't just like flip a switch and be like, okay, I'm going to be more mindful about this thing now. It's more about, okay, well, I did a lot of work around that control thing. And so it's amazing the way that my life has changed in regard to control. And in those moments where I find myself becoming anxious and wanting to kind of grab a hold of a situation that I really don't have control over, it's like, you know, the integration work that I did helps allow me to take a step back and listen to the parts of myself that don't need to control and allow those parts to lead me through what is a very uncomfortable or scary situation for me.
Oh, I mean, I'm like so happy just to hear your story.
Yeah.
Yeah, I definitely think integration is what makes ketamine therapy, I think, so unique from just doing ketamine someplace. You know, one of the questions I get a lot from my like clients is, you know, can you get addicted to ketamine? And my answer generally is you can get addicted to anything. There are people who are addicted to food. There are people who are addicted to gambling, to water and certain types of eating disorders and things like that. Like, and too much of anything can cause an addiction. The big difference, though, is that integration is really, really focused on making a bridge between where you were during that ketamine experience and where you want to go forward. And I think that really keeps people from going into that addiction zone. And it's not the same kind of like, you don't get the same kind of physical cravings for it. So can you speak a little bit to where that, like what K-space is like for people who don't have psychedelic experience?
Yeah. So I actually didn't get fully into the psychedelic space until my 6th and final ketamine session, which is kind of a bummer, but also, you know, that's how it was for me. And it was one of those things where as much as I wanted to get there faster, I don't have a say in that. So that was another kind of great lesson in not being able to control. So what I will say is, I kind of differentiate between two things on ketamine. There's tripping, which is when you're in the psychedelic space. And then there's also kind of being high. So on lower doses, I just kind of felt silly and like the body, it's really a body feel thing for me. Like I become very leaden. I would also almost compare it to like being drunk. That's how your body feels. Like you can't really walk straight and you're a little whatever. But in the psychedelic space, which is when you're tripping, it's so hard to explain. And everyone who's done this medicine, whether it be recreationally or clinically, will tell you it's really, really hard to describe the psychedelic space. You know, Bobby described it to me, and I totally agree. And I've taken this in all of my descriptions. It feels like coming home. There's something like very comforting and very natural about the psychedelic space. You know, I thought that there was a chance that it could be that I might become scared because it is, I mean, visually it's wild. You know, I had sacred geometry visuals. I had lots of like weird nature kind of fractal visuals. Going back to nature was something that Bobby and I discussed as a strategy for when that kind of control monster takes over. Because some of the most tranquil and beautiful experiences of my life have been in gorgeous parts of nature. And I find a lot of peace in that. So I think that kind of wormed its way into the psychedelic space for me. A lot of mountains, lots of forests, no beaches because I don't like the beach, but I love mountains and forests. And so visually it's a lot of that, but there was a moment when I kind of dove headfirst into the psychedelic space in my 6th session, where I was like, oh shit, like, excuse my language. I don't know if I'm allowed to swear. I was like, oh shoot. You know, like this is a lot. But then, you know, there was this kind of, it was my voice, but there was this voice that kind of came over and was like, you're just at field trip. You're fine. Like, you're good. Don't worry about it. And then from there, I was like, all right, let's go. And just kind of, it was almost like watching your favorite movie with your favorite first person. So it was really, really special, very comforting. I don't know if I cut out there for a second, but if I did, you know, like tripping is like watching your favorite movie with your favorite person wrapped up in your favorite blanket. It's so warm and joyful. So yeah, I hope I did it justice.
Yeah, well, and I think like this idea that you can't really describe it unless you've been there is the reason so many of our therapists have done their own experiential training,
Yeah.
so that we're better able to help coach a person to prepare for it.
Yeah.
Of course, like when we're giving people kind of the risks and benefits, like any ethical form of treatment, we warn people sometimes difficult things can show up.
Absolutely.
But it's often in a different kind of way. Ketamine is antidepressant, it's anxiolytic, meaning it reduces your anxiety. So even if something distressing does show up, like a difficult memory that ketamine thinks you need to deal with now, a lot of times it feels more distant, or you feel more equipped to handle it.
Yeah. So actually, I don't remember if it was my 5th or 6th session. Because in my 5th, I like dipped my toe in the psychedelic space, but my 6th, I was like all in. So I have a very complicated relationship with my dad. He was, don't tell him I said this, but he was emotionally abusive growing up and emotionally neglectful. I'm a very sensitive person and a very emotional person. I pretty much wear my heart on my sleeve. What's on my face is probably what I'm feeling at any given moment. I'm a crier, like I just cry all the time. And not necessarily because I'm very moved to cry, but just because that's my body's physiological response. And when I was a child, and I'd start crying because he's yelling at me, he would accuse me of manipulating him, of using tears as a way to get what I want. So like constant invalidation of my true feelings and of me as a person. I was never good enough, all of that kind of stuff. And I've really struggled with my relationship with my dad in adulthood, because I want to let all of that go, but it gets triggered often. And especially in my relationships, it's triggered in how I treat myself, and kind of like always accepting what I get instead of trying to get what I deserve from others and from situations like jobs, because I just have, it's getting better, like zero self-worth. And that cycle in depressive episodes is just crushing. And I've tried medication. I've been in therapy for years. Therapy helps, but it's a slow process. Medication was not for me. I had very adverse reactions to everything I tried, including severe suicidal ideation. And, in this one session, in like session 5 or 6, my dad, a picture, it's actually a photo of my dad from when he was commissioned into the Army, kind of like floated into my visuals. But it was in color. The actual photo's in black and white. And the photo's taken kind of like looking up at him. And in my visual, it was, we were face on. And I said goodbye to the father of my childhood, so that I can have a new relationship with my dad, and I can live without those feelings that have been ingrained in me through my interactions with him as a child, holding on to these deep, deep, deep wounds, which are still there. But they're kind of scarred over a little bit. They're not sensitive like they used to be anymore. Of course, sometimes he does something that triggers those feelings. But I'm really good at naming them now. And so, yeah, it's like, it's very, very strange that in this space, this thing came up that has been this albatross around my neck for my entire life. And I was able to have a meaningful and joyful experience saying goodbye to this, to this trauma. I still have complex PTSD. That hasn't changed. But its impact on my day-to-day life is so reduced. And same thing with depressive symptoms. I had my first depressive episode a few months after treatment, but like, dang, going like 60, 90 days, not feeling depressed for the first time in my life. It was so incredible. And all the work that I'd done in therapy prior to my experience at Field Trip really laid the foundation and gave me the language that I needed to really engage in this treatment 100%. And I don't think that that's a requirement by any stretch of the imagination. But for me, it was very helpful. So, you saying the medicine has a way of bringing things up sometimes that you don't really even know you need or that are going on. Like I thought that I could just be okay with my dad, that I should be able to move on, just by choosing to, but that's not really how it works. Not for me at least. And so, the medicine helped me to kind of dig up something that was deeply within me, this need to say goodbye. So yeah.
It's interesting that you use the word scarred over, because I often think about ketamine as an expressive rather than a suppressive, meaning it helps get stuff out of us rather than shove it down deeper. I think about it like cleaning a wound. It's like sometimes we've kind of healed over, but there's still the infection underneath. Right. And this type of therapy kind of helps it express so that it can heal a little bit better.
Yeah, though I would agree with you. I'd say it's almost like I had an infected wound. I got the infection out so that the wound could actually heal, like in a more permanent kind of way.
Yeah.
Yeah.
Well, I know we want to hold some time for Q&A, so I guess I just kind of want to open you up to just one last question. If there's anything else you want to share, I just love hearing your story too, and I'm so grateful that you're here with us.
Thanks. I'm glad to be here. I guess the thing that I really want to share is, having been in treatment for so long in therapy and trying medications, working with multiple psychiatric providers, this treatment has given me, I was saying earlier that like these symptoms and these illnesses have been like an albatross around my neck. And I don't know that I'm ever not going to be depressed. Like, I don't know that I'm ever going to be mentally healthy, or whatever you want to call it. I'm probably going to experience depressive episodes and anxiety for the rest of my life. But Field Trip and CAP gave me some perspective on the fact that doesn't have to be the worst thing. It's not a death sentence. Sometimes it feels like a death sentence. And it's okay that it feels that way sometimes. But, there is some hope in my future now because of this treatment. And I get emotional talking about it because, there have been so many depressive episodes where I've gone to my therapist and I've said, I cannot do this. Like, I can't do this for the rest of my life. Like, I can't continue to experience this so regularly, wanting for it all to be over. I can't do that for the rest of my life. And now I feel like there's respite. There's something that can help me to take the edge off when the work that I'm doing doesn't get me where I want to be. Or I can take a break. If I do CAP twice a year, then for half of the year, I get a break from all of this. And I'm not saying it's as effective for everyone. But I decided to jump into this, whether or not it was effective for me, because I needed to know if it would work or not. I needed to know if I could find a break in the storm somehow. And I feel so fortunate, and the success rates for CAP are incredibly high, like in the 90%. So, I just really want to communicate that this is life-saving treatment. And I don't know if it saved my life, because I've done a lot of work to get to a point where my life is not in danger. My safety is not in danger. I'm not a danger to myself. But it's the work pays dividends. I mean, it's hard and it sucks sometimes, but it's totally worth it. So I guess I'll end it on that note.
I don't know how I can top anything like that. So thank you.
Yeah.
Yeah.
I really believe in this.
And I do too. And I think that's what brings people together in this kind of work is people don't practice this unless they really believe in it. And I think that's when, I think therapists always kind of believe in what they're doing, but it's to the point where I almost feel unethical doing other kinds of therapy that aren't as quick acting.
Right.
And it's such a client-focused one too. It's not me teaching a person. I know a little bit about the lay of the land, but it comes from within. 100%. It comes from your own inner intelligence. And I think that is such an important part too.
Yeah, I'm really glad that you highlighted that because it's so the case. There were so many times with Bobby where she would, where I would kind of want an answer from her and she was like, you have the answer. Mm. And I think that the medicine really brings that out.
Thank you.
Yeah, thank you.
Hey, Jordan. Hey, Katie. Thank you so much for sharing, Katie. It's always wonderful to hear your story. And I really appreciate like your vulnerability. And I know the entire group tonight does as well. So thank you for that. And for sharing that space with us. I'd like to open it up to a few questions that we've gotten in. Maybe Jordan, I'll pose this one to you. Can you talk a little bit about what the process of matching clients with the therapist looks like? And really maybe even a little bit before that, like what does the intake look like? So if somebody wants to decide they want to start working with Field Trip, what can they expect next?
Yeah, so the first step, I think at this point, people can actually sign up for their first psychiatric assessment themselves on our website, which is really nice that they've taken out kind of that middle step. So the first one is really just kind of a brief assessment with a psychiatric nurse practitioner or a psychiatrist in some cases to rule out anything acute. We want to make sure that we are the right level of care for a person, we have what they need. And, kind of a brief assessment if there's any major cues that there might be something medically that would rule them out from CAP. After that, they are assigned to one of our therapists. We have a lot of diversity among our therapists. I am also trained in EMDR. I focus a lot on trauma-focused therapy and trauma-type disorders. I've done a lot of work with like refugees and immigrants, and so that's kind of my subspecialty. I used to work with art therapists. We have people who are really into the music side of things, people who are really into more like behavioral changes. There are dance movement therapists at some of our locations. And so when they're making it a kind of a pairing, some of that does get taken into consideration. What is a person's primary diagnosis? What are modalities that they've tried and liked or didn't like? And also kind of what's their availability for appointments. Some of our offices have evening hours, some of them don't. And so that's one of those things that also gets taken into consideration.
That's a great, Jordan. Yeah, we have an amazing like depth and breadth of qualified therapists and medical personnel at Field Trip. And it's always amazing to hear about their expertise and specialization. And actually some of the theories that ground the work that they do, I've actually found that super interesting working with Field Trip. There's a few other questions that have come in. One is around SSRIs. So one question is to say, if a person's currently on SSRIs, how long should they be off any meds before they commence with CAP? And another kind of related question is to say that someone's been on SSRIs for a year and feel like they haven't really had much of a positive effect, and just kind of like interested to understand, does CAP work for depression and anxiety?
Yeah. So first of all, I can't make recommendations, and I highly recommend that people talk to their psychiatrist about whether something's working for them or not. That said, I have lots of clients who are on SSRIs. Really the only psychotropic med I know that people get told to not take in the morning are things like benzodiazepines that are sometimes prescribed for anxiety, as well as muscle stimulants. There are a few other things that are more on the medical side, but you would be able to talk to our medical team about that. And if it's something that maybe you can come off of, then that's something you would talk to with your psychiatrist as well, but definitely not a rule out.
That's great. And maybe we could talk a little bit about the administration of ketamine itself. How does Field Trip administer it? Do we use IV? Is it oral? And why do we choose certain methods to administer ketamine with?
Yeah. So our clinics use intramuscular. So that's basically like a shot, kind of like a vaccine, for example. It just goes into your arm. It's a single shot. Some days you might get two if you're trying to get into a little bit deeper and the first shot wasn't enough. But you don't have to walk around with an IV. You don't have a whole lot of contraptions attached to you. It makes it feel a little less clinical, I think. There are some places that will do intranasal, meaning you kind of inhale it through your nose. Some places use lozenges, but I think the one nice thing about the intramuscular, there's a few things. One is you're not connected to stuff. The other is that it really promotes that work on control. Because once you have the injection, you're going through the experience. You don't have to go through it alone. But like IVs, for example, you can kind of dial it back. But I think for the full psychedelic experience, that's the way that stuff was traditionally administered too, is if not an injection, you were consuming something. You can't unconsume something. And so I think it lends itself to some of the traditional practices of psychedelics as well.
Nice. And just for clarification, I think in some of our Canadian clinics, they use lozenges.
Mm-hmm.
We have another question around like how long the effects last. I know that we recommend that patients, they cannot operate a car after, they have treatment with us. They have to get a ride home. And what other kind of like after effects do you know about that happen after a medicine session?
Yeah, so that peak experience that Katie had been talking about, that part where you're actually in the psychedelic or maybe feeling a little high, that usually lasts anywhere from a half hour to an hour for most people, with kind of the average being about 40 minutes. We do tell people to hang out in the clinic for, a total of 2 hours from your appointment start time till the end, sometimes up to 3 hours, just because you can feel a little off balance or some light sensitivity that might make it hard to take off. And then, like you said, we don't want you operating heavy machinery or doing hard exercise until you've had a full night's sleep. Most people feel fine in the morning. Some side effects, things like nausea and headache, we have stuff that can kind of mitigate those effects the day of, but not super common. And like I said, by morning, most people are feeling kind of back to physically their normal selves.
Nice. Katie, just want to share a few notes that I'm seeing in the chat for you of people. Thank you for sharing your remarkable story. Your insights and your experience have been super helpful. And so I just wanted to take a moment to acknowledge that. And actually, I have a question for you, Katie. Have you been using any new tools or techniques since you've completed treatment?
Yeah, totally. So I've started a meditation practice, which has been really helpful for me. It's not even necessarily I'm not super rigid about it, because rigidity is something that I'm working on. So basically every morning before I get out of bed, I make sure that I spend 5 to 10 minutes lying in bed and just kind of allowing myself to relax before the day starts. Sometimes in the evenings or in the mornings, I'll do an actual breathwork exercise, usually for no longer than 10 minutes. I have my favorites that I listen to on a regular basis. And the big thing for me is, mindfulness, but without being perfect about it. So that's a big one, is kind of checking in with myself on a regular basis throughout the day, or when I'm feeling something really strongly, taking a moment to appreciate the feeling that I'm having. And when I say appreciate, I don't really mean like it, but to really kind of pause to be like, okay, this is what I'm feeling right now. And making sure I'm labeling it and giving myself space to feel that thing. That's a practice that I picked up in treatment that has really, really helped me to draw more effective boundaries with people in my life and with myself. Being able to check in on those things and kind of figure out what it means in the moment instead of just kind of shunting it off to one side because I don't have time for it or it's uncomfortable. So
Yeah,
those are the big things.
that's great. I love that idea about labeling emotions.
Mm-hmm.
It's such a clever technique. And I've actually integrated it into my life a little bit too. So it's been really helpful.
Good.
It reminds me of when you were talking about getting to know different parts of yourself. And I think getting to know each of the emotions, it really helps.
Yeah. Yeah. Because we use emotional language so seldomly in our culture, in my opinion. And so really taking the time to differentiate between like sad, or, you know, heartbroken or adrift or, you know, all of these different things and positive emotions too, like joy or wonder, you know, have it like being able to actually stop and be like, okay, this is what I'm feeling. It helps a lot to kind of own my experience.
That's awesome.
Totally. So I think that we are probably going to be coming to a close momentarily. But I would certainly like to thank you, Katie, for joining us tonight and sharing your incredible story. Jordan, thank you so much for guiding our discussion and for opening with a beautiful meditation and bringing and sharing some of your expertise to this forum tonight. And certainly I'd like to thank all the attendees. Thank you for your engagement and your questions. We love hosting this space for you, and certainly encourage you to please get in touch with us if you have any more questions as this beautiful and emerging space continues to gain traction and visibility. We're certainly here to shine a light on everything that ketamine and psychedelic therapy can do for others. Okay, so with that, we're going to play a quick 60-second video to close. It's just a nice showcase of our clinics and what it looks like inside to give the audience a bit of a better idea of what working with Field Trip can look like. So on that note, thank you again, Katie. Thank you, Jordan, and thank you to our participants for tonight.